Our consulting report was on Deadfoot and the WFFA, and this was done by Jared Gullison, Peter Borden, Brian Cooey, and Trevor Pearson. So what is Deadfoot? Deadfoot is a perennial neuropathy, which in layman's terms is just nerve damage and is caused in the perennial nerve, which is located in the lower half of the leg. So the shin area um, down to the bottom of the foot. And this nerve damage and injury is impacted by millions of Americans and has not only a caused by nerve, but as well as muscular dystrophy as well. And so some of the symptoms include limited mobility in the foot and the ankle area, and as well as numbness due to the nerve damage, as well as poor circulation throughout the foot. So some of our objectives to this consulting project, the main one is to educate the WFFA about Deadfoot and the threats it poses to the association, as well as treatment for the injury for its athlete for their athletes, and as well as preventing the injury as well. So for treating, the main and tried and true uh, treatment that we researched was the RICE, so rest, ice, compression, elevation. What this helps with is just healing, overall, just healing the injury and the ankle, and as well as just regaining mobility in the foot. And it really helps a lot with dead foot. And another is just standard medications, so non-steroidal anti-inflammatory drugs such as like ibuprofen, aspirin, etc., to help reduce swelling and overall pain of the injury. And another is physical therapy, so treatments through stretching and just to regain mobility and strength in the foot, and other alternative therapies such as like massages and acupunctures to regain blood flow and mobility as well. And in serious cases, especially with like serious nerve damage, there would also be surgery to be had. And as far as preventing dead foot, especially in the WFFA and their athletes, proper footwear is essential due to the fact that they are performing strenuous movements, especially with their feet, and are putting serious wear on their ankle and their shin and those muscles. So proper footwear is crucial for them. So proper arch support to support their entire foot, and stretching as well. So before any performance or anything, that like having the proper ankle stretch and movement is crucial to prevent injury, as in any sport or anything, any type of activity, stretching is crucial. And this is no different. And as well as strengthening the foot, stretching kind of goes hand in hand with that, but just making sure prior to doing any sort of performance or any activity, like strengthening their foot, making sure they're adequately equipped and their foot and their muscles are up to speed, and increasing mobility through stretching as well, and making sure that they aren't sore or having limited range of movement to prevent further injury. And some of the stakeholders in this include the athletes directly, because they are the ones dealing with the injuries and dealing with the pain and then the recovery that comes along with it. And secondly is the WFFA themselves, because they are the association directly associated with the athletes, and they have some sort of responsibility dealing with those injuries and preventing, giving players and trainers and etc. Knowledge and harnessing that. And then lastly, the trainers and coaches themselves. So they are responsible for knowing these injuries exist and how common they are, and as well as like forms of like different treatments such as like physical therapy, and then helping treat those players not directly, but guiding them in that direction to be treated to make sure that they stay healthy.
All right, so my section is on the analysis and the benchmarking of deadfoot. So as we really had to question what deadfoot is, where it comes from, how to overcome it, it was very important for us to acknowledge the testimonies of the people who have actually endured this pain. Thankfully, we were given 9 different people's answers to how much they to testimonies to what they experienced through this injury. So they were asked a bunch of different questions. We were given all the answers, all 9 people. And we were able to break it down and really analyze those different answers, look for causations and correlations between them. Questions are both quantitative and qualitative. So they're both direct, open-ended questions, but also some yes or no questions, some how long questions, with more open-ended questions at the end as well. So looking at the first few questions, as you can see, the average length of the freestyle's career was pretty long. It actually was 9.75 years, with the shortest amount being 5 years and the longest amount being 16. The average of years, the amount it took for deadfoot to appear and inhibit their ability was just under 4. So it was a very short time for freestyling to affect these players. It really didn't take long. The average age was under 4. Average years were under 4, including multiple that were immediately or almost immediately. 90 or almost 90% of responders experienced deadfoot within 6 years of starting. So most times it didn't take a long time for it to start. Well, this tells us that it's pretty clearly the injury is pretty clearly directly related to freestyling. So if it took a long time for this injury to occur, then it's a weaker correlation between freestyling and the injury. But considering that for all these players, they never experienced this injury before, and then it quickly, for most players, 4, 5, 6 years appeared after starting freestyling, that shows a strong correlation between freestyling and this specific injury. Another thing I want to point out about this is the current pain category. All 9 respondents say they're still feeling current pain. One of them claimed it's much better, but still experiencing it, which shows that they clearly were not able to solve this, unfortunately, and are still dealing with this issue today. The next set of questions is about the diagnosis and the specific area where this occurred. So all players were asked if they had a diagnosis from a doctor. Only one of the 9 respondents said they actually had a diagnosis, and that diagnosis was later determined to be incorrect. They didn't think it was the right diagnosis. A common trend was the doctor saying that it was only in your head, that this wasn't all mental injuries, which was very, very interesting to us. As for the training area, as for the problem area, a lot of lowers, which makes sense because the injury occurs in the low. And most of the time, the problem area was where they trained a lot, which makes sense, which once again proves or encourages evidence for our correlation between this sport and the injury. We'll continue on to the next set of questions about preparation for training. The majority of the respondents would warm up before training, but a lot of them wouldn't train that muscle area, wouldn't work out that muscle area. This could be a reason for this injury, because often when you work out muscles, they get stronger. It's harder for them to get injured. But when you use a muscle a lot that isn't strong, that you don't actually work out, it's more likely to get injured and hurt. And that is something that we see here, is that often they warmed up before, but they would not train that actual area, that part of the body, work it out, make it stronger, which could have potentially help prevent these injuries. Moving on to the last few questions from these respondents. So they were asked, these were the more open-ended questions at the end of it. So they were asked what they think the cause was, what they found the solution to be, and anything they would like to share with anybody else experiencing this, or the people that would be reading this. So as you can see, the general theme that was shown to us was a variety of injuries, potential injuries. Besides two people who claimed they had absolutely no idea, every single supposed cause that they thought it was different. Every single cause was different. Now this shows us two things. One, it can show us that this injury could come from anywhere. But two, and I think this is what our group really noticed, is that they're not sure where this injury comes from. They're not really sure why, because of how many different reasons they think it has. Some say mental, some say too much training, some said not enough training, not working out that muscles. Some say, past strains or yips. One person said yips. It's there's so many different reasons that they think it happened that it shows that there might not be a reason that they have not figured out why this happens. Every single solution was also different. As you can see, looking at the chart right here, some said no idea. Once again, some said going back to basics. Some said just ignore it. Some said opposite stretching. Individually, sorry, not some, but and one person really thought mental training would help a lot, which is, as I mentioned earlier, goes along with the interesting trend we saw of people claiming that it might be a mental injury. The general consensus that we gathered from all this information was a collective sense of confusion. No one really seemed to have answers, both on how it was caused as well on how to fix it. So that's the conclusion we came to when it came to the causation and the solution. But we definitely do think there's a strong correlation and a causation between dead foot and freestyling.
Hi, I'm Brian. I'll be going over the execution and actions section of our presentation. For execution and actions, we have come up with 6 suggested courses of action to help the WFFA show their level of commitment towards injury prevention in the eyes of their stakeholders. For first execution and action, we would advise the WFFA to establish and promote safety guidelines. This would involve the development of an official fundamental catalog for the WFFA. This catalog would involve the proper techniques, warm up and cool down procedures, stretching routines, and drill work necessary to safely participate in the sport of freestyle football. We would also advise them to share this catalog with the athletes, coaches, and event organizers, pretty much anybody that is going to be participating in the sport or coaching the sport. Now jumping to our next execution or action, which would be to provide training, education, and training. We would advise the WFFA to provide educational and training sessions. In these educational and training sessions, we would just make athletes aware of the possible injuries that could happen while playing the sport and how to best prevent these injuries from happening in the first place. In providing the education and training, we want to make sure to broaden the accessibility of the offerings and teachings of the educational and training sessions. This might include offering things like online workshops, online courses, and online seminars to reach the broadest amount of audience possible. Jumping to our next execution or action, which would be to collaborate with medical professionals and experts. We would advise the WFFA to partner with trusted sports physicians, physiotherapists, and sports trainers. These sorts of trusted medical professionals can provide valuable input on the injuries that take place within the sport. They can also help the WFFA to conduct research about the injuries that are specific to the sport of freestyle football. And they can also be a means of providing first aid training to the WFFA's athletes that would allow them to self-treat injuries in the case that they do not have medical professionals available. Now jumping to our next execution or action, which would be to promote safety culture. This would involve running regular communication and awareness campaigns. In these communication and awareness campaigns, we would advise the WFA to post quick tips on injury prevention techniques regularly on their social media, and by using social media to leverage these communication and awareness platforms and campaigns to really push the message on social media and make it available and seen in the eyes of the stakeholders. Our next execution or suggested plan of action would be to engage with the stakeholders as much as possible. This would involve building strong relationships with the stakeholders, establishing a fluent line of communication with the stakeholders, and making sure that the stakeholders' input is valued and stakeholder needs are always being taken care of. The idea of engaging with the stakeholders would be to just work hand in hand with the stakeholders, taking their input, especially their input on injuries within the sport, and always to just make sure that we execute on the input that is being given by the stakeholders as a means of keeping them happy and allowing them to realize that we are valuing their input and taking the actions necessary to appease them. Our final execution or action would be to regularly review and update safety procedures. With freestyle football being an up and coming developing sport, and the injuries, the research into the injuries kind of being at with freestyle football being an up and coming sport, and the latest medical research not really being as available as for other sports, we would advise the WFFA to regularly update their safety procedures as no information arises within the injuries specifically related to the sport of freestyle football. We also want to make sure that what the World Freestyle Football Association is doing in terms of injury prevention and educating their athletes aligns with stakeholder values. So we want to make sure that we really take the feedback from stakeholders and take the actions that they want to see necessary for providing healthy and safe practices for our athletes.
Thank you, Brian, for sharing that. Next up, we got recommendations. So the team has done a lot of research regarding recommendations to avoid injuries and to avoid dead foot as a whole. So our first recommendation is warming up. You obviously want to warm up before any physical activity. Good warm-ups consist of dynamic stretching, and this allows for an increase in blood flow. Dynamic stretching is different from static stretching because you're moving around constantly. Blood's flowing, and it also helps activate your nervous system. And we found that the nervous system is most likely the main system that is related to dead foot. The second recommendation we have is using the appropriate equipment for freestyle football. As you know, if you ever watched freestyle football, I know Mina does a lot with freestyle football and plays it. But from watching it, we realized that it's a high impact sport, and it's mostly played on concrete, or the athletes play on concrete or like a padded surface. And eventually, if it's a harder surface, it creates a lot of impact. So having the right shoes helps out with that. So the next one is gradually increasing activity levels. So instead of just going straight into like a 20-minute juggling session, start out with like a 1 or 2 minute one and then eventually keep going. And this allows for your muscles to get warmed up, and it reduces the risk of straining a muscle or injury. And when the muscles are given the right amount of warm-up time, the amount of risk decreases. And this also isn't just day by day. It's the scheduling needs to be monthly. So it's on Monday you're juggling for 30 minutes. Tuesday maybe you'll have a rest day, and then you can go harder on the weekends. And overuse, this kind of flows into increasing activity levels. When you overuse your bodies, that's when risk for injury increases. So avoid it. Don't overuse your body, and when your body's telling you no, stop. And yeah, repetition gives stress to muscles because you're using them over and over again. So really ensure that you're getting rest and stretching and all of that. And lastly, if you do run into an overuse problem, if you find yourself in pain that's unbearable and it's not going away, go seek medical attention and go find a doctor because in most cases, what we found is if the PNS system is injured, you can help that, but you have to catch it on early. So yeah, seek help. So moving into lessons learned, kind of wrapping up this presentation. Our team, we went through a lot. We're busy college students. A lot of the team has work throughout the week, super busy schedules. We have other classes. So figuring out times to meet, even meeting with Mina, it was hard to find a time where we could all get together and do that, but we adapted and pushed through. And also finding research. Deadfoot is, like Mina said in the beginning, Deadfoot is non-researched. It's new, and we're the first researchers to really get a grasp on what's happening to these athletes. So that was really cool. And yeah, thank you. And thank you, Mina, for all the help, and Professor Doss. That was incredible, and thank you.